Away from politics, as the menace of drug abuse among youth in Nigeria keeps growing, medical experts are showing concern about the impact it has on the populace. The president of the Nigerian chapter of the International Society of Substance Use Professionals, Dr. Martin Agwogwe, at the fifth annual conference of ISOP chapter in Abuja, called on Nigerian universities to establish addiction-related programs to train relevant manpower for the prevention and treatment of substance abuse. Clearview's Florence Joshua brings us details.
Statistics have it that no fewer than 29.4 million Nigerians aged between 15 and 64 years abuse psychoactive substances and other dangerous drugs, and this is authoritative and coming from the National Drug Law Enforcement Agency at the Abuja conference. A consultant psychiatrist with the University of Jos, Professor Moses Aldo, also hinted that most addiction issues were treated as a course in medicine, but there is now a paradigm shift and ideology has become a field of study. The professor of psychiatry disclosed that a curriculum on addiction has been developed for the standardization of the profession and practice in Nigeria, calling on more universities in the country to initiate programs on the field.
Nigeria, as it is today, is in crisis of drug and substance abuse. And our university system or higher institutions of learning cannot fold its arms and watching this crisis. So there is the need for higher institutions of learning to join other stakeholders in developing addiction programs towards building the workforce. Because we need workforce with adequate knowledge and skills in evidence-based prevention, treatment, and of course, supporting research activities.
Also speaking, the NDLEA boss, chairman of the National Drug Law Enforcement Agency, Buba Marwa, and the country representative of the United Nations Office on Drugs and Crimes, Dr. Olivia Stope, stressed the importance of training academics in the fields of addiction to equip professionals with skills for intervention.
As we delve into the prospects and challenges of integrating addiction science courses into our educational institutions, we are embarking on a transformative journey that can redefine how we perceive, understand, and ultimately tackle substance use disorders. Through education, we can foster empathy, reduce stigma, and promote evidence-based practices in prevention, treatment, rehabilitation, and care.
So we must focus and understand that the researchers play a very crucial role in how we respond as a country to the situation that we're in.
These stakeholders believe that Nigerian universities have the task of playing the crucial role of how the country responds to the drug epidemic ravaging its youth, and that it's academians that would provide the evidence to enhance the response. Florence Joshua reporting for Clearview News Desk.